You're listening to the Movement is Medicine Show, a podcast hosted by Head to Toe Spine and Sports Therapy, a modern chiropractic and manual therapy practice in Edmonds, Washington. Now, let's get into the show. What's up, everybody? Welcome.
What's up?
Hey, Barry.
We got Ashley here, Dr. Ashley. We got Dr. Lee, Dr. Annie. Happy day, everyone.
Happy day.
So today we're going to get into a really interesting topic that I know nothing about, but that Ashley knows quite a bit about, and that is neurodynamics.
Yeah, this is actually the Dr. Ashley show.
Yes.
Lee and I are just guest stars.
Just spectating.
We're spectating.
Yeah, and so one of the cool things about having a diverse team of doctors here is that we have a diverse variety of treatments that we can offer, and everybody has some different specialties that they bring to the table. And of course, this neurodynamics is one of your unique specialties, one of the areas where you've kind of gone deeper and further than everybody else. Yeah, so talk to us a little bit about, what is neurodynamics, and then maybe we can get into some use case scenarios, like how we use it to treat different things.
Totally. Clinical neurodynamics is a protocol technique approach by an Australian physical therapist. His name is Michael Shacklock. And if you break the word down, neuro and dynamics, neuro being nerves, nervous system, dynamic meaning movement. That's essentially what's happening. We're taking the nerves within your body and we're moving them. And we're putting your bodies in different positions, putting the nerve in different positions to kind of see where that nerve pain is coming from. And so if you didn't already guess, neurodynamics is essentially for folks who are dealing with nerve pain. And nerve pain, if you want to break it down to more of what the symptomology is, you could be dealing with anything as classic as numbness or tingling in your hands, in your feet, down your legs, down your arms. If you want to get into things that are a little bit more named, like thoracic outlet syndrome or carpal tunnel syndrome or sciatica, for example, that one's pretty mainstream. Neurodynamics specifically helps to target where those symptoms can be coming from, and it adds a little bit more value to what is already done mainstream-wise to treat those kinds of conditions. So it kind of just gets it a little bit more specific in that way. So
I'm curious as to sort of how we could unpack, like, let's look at low back pain a little bit.
Sure.
Because it's something we see so commonly at the clinic. And maybe we could unpack for our listeners together a little bit about how that would combine with maybe what they're more used to receiving here at Head to Toe, where we're looking at, we see a lot of disc injuries or discs that are just starting to get a little irritated, maybe a little inflammation around the nerve pathway. And I know here we're looking at, of course, the essential core work, but also looking at really allowing that disc to calm down, finding a position that the body has some positional relief, trying not to over-irritate that nerve. And, of course, treating the soft tissues like in the hip and the hamstring around that sciatic nerve pathway to try to sort of release compression on it. So I'd love to see kind of how you would combine your approach in with that.
totally. I mean, obviously there are a lot of approaches to treating that low back and nerve pain. There's the soft tissue, the actual structural being disc, and then you got the nerve itself. I think the really nice thing about neurodynamics and what I do is that it really helps to break down where exactly along that nerve pathway you're getting majority of the symptoms. So if you think of the nerve itself as kind of like a rubber band or like a spaghetti noodle, so to speak, there are many areas along that structure that you can either stretch or compress. And with the different positions that we're putting your body in with these tests, we can kind of pick apart where exactly it's starting from so that we know where to treat. The nerves within your body starts at the spine, starts at the disc and the nerve root, and then it'll kind of, work its way down your lower extremity and down your arm. And so there's many different areas where, that nerve can get compressed or stuck. And figuring out the best place and the most bang for your buck spot that we can treat that area is going to be really important. Obviously, decompression of the disc is going to be great. Doing like a McKenzie directional preference type of movements is going to be important too. The biggest thing is making sure that we can centralize that radiating pain. Basically, get it back, and out of your foot to maybe closer to where your back is. And so using neurodynamics in different positions and all those tests is going to help us figure out how to do that.
Yeah, I think it's important to understand that there's multiple things that can affect neurodynamics. Like it could just be like a really tight muscle. It could be that there's been buildup of tissue around the nerve itself. There could be a lot of swelling in an area that swelling itself is causing increase in pressure, and that's actually compressing the nerve, causing symptoms. So there's many things that can cause these symptoms. But like what Dr. Ashley's talking about is actually identifying where that structure is really being impinged and addressing it very specifically.
Yeah, this is kind of like where we take like a Navy SEAL team and they go in with their laser and they put their laser right on that specific building and then bam-o, we missile that building.
Exactly.
That's what we're talking about here.
Yeah,
That's
very
Dr.
good.
Ashley.
You
Yes,
nailed it.
Totally. This is
There's
a little
so
war
many
analogy. I don't
working
know.
parts.
Get a little
It's
Jack
too
Ryan
much.
in it.
Yeah.
So when we were kind of riffing about this topic beforehand and you were educating me, you brought up how a lot of people, when they do have that nerve pain, that tightness in the muscles, that sort of fascially burning feeling, they want to stretch it out. That's kind of our instinct, is to stretch it. And that's not always the best idea for people to do. So talk to us about that a little bit.
Nerves in general don't like to be compressed or stretched. So if you know for a fact, and obviously you need to go check it out if you want to know what's going on, but if you in fact have some kind of nerve issue, nerve injury, the last thing you'd want to do is stretch it. That's just going to exacerbate the problem. And I know, like Dr. Annie said, a lot of people, that's kind of their go-to. The first thing they would want to do is just kind of elongate those tissues and just kind of get that feeling of relief in there. But oftentimes when you do that, the relief is there maybe for a little while, and then that nerve issue kind of comes back again. And so, like I said, the last thing you'd want to do is stretch out those structures. And in that way, we would want to make sure that, okay, instead of stretching those structures out, we need to create space for it. And like Dr. Lee kind of touched upon earlier, there's a lot of working parts that go into pain in general. You know, could it be coming from a muscle? Could it be coming from swelling? Could it be coming from the actual nerve itself? And so really, really kind of diving in there and figuring out what structure is causing that pain is going to be the most helpful. And I think that's really, really great about, you know, the practice. Head to toe, everybody does something different. And if something's not working, obviously we're going to make sure that we touch upon those different areas to make sure, okay, what's going on and how do we get to the bottom of it?
Right. I think the most common would be like, oh, my hamstrings are really achy. Mm-hmm. I'm going to bend over and touch my toes, touch my shins, try to stretch that out. Stretching is always going to feel good because that is it's motor control. I mean, it's your body moving, and when you move, your body doesn't feel pain. So it's kind of more disguising that pain. It's taking your brain off it. Like you ever hit your elbow, you rub your elbow. That gets rid of the pain while you're rubbing it. As soon as you stop rubbing, the pain comes back. The same thing's going to occur after you stretch, if it's not appropriate.
So neurodynamics, we talk a lot about sort of releasing if there is nerves stuck on tissues. I know in my work with active release, certainly I've spent a lot of years kind of decompressing around the nerve, trying to strip fascia off the nerve and take the pressure off that nerve pressure. But you also talk about sort of gapping and creating more space for the nerve, maybe more at a spinal level or an extremity level. Can you talk a little bit more about what you're doing there?
Yeah, totally. There are a lot of relief positions within neurodynamics, and relief positions. When I talk about relief positions, I'm talking about creating space at an area. So if we're talking about the disc, for example, and where the nerve root is starting at that spinal level, we want to create as much opening for that nerve root to breathe and for the nerve downstream to also be able to breathe and then communicate with that starting spot. And so these relief positions, I mean, as much as we can do it in the clinic, these are also things that you can do at home. And they're as simple as, laying on your side and just being in a position where we're opening up on that area. So if, for example, you're experiencing low back pain and some right-sided leg pain, we're going to put you in a position where we can open up where that nerve root is in the spine, just to kind of give you the most relief. And the same thing can occur in the upper body as well. You got discs all the way up and down your spine, and so there are many different relief positions that you can do and that we can teach you to help take pressure off those nerves. And obviously, these relief positions are not something that you can maintain throughout the day. People work, we have lives, and so as much pressure as you can take off, as much as you can throughout the day is going to be great. And there's obviously a progression to it. We want to eventually get your body and that affected nerve to a spot where it can withstand that tension again. And anybody with, no injuries and normal nerve function, nerves should be able to withstand a little bit of tension. And so it's just kind of going through that progression and getting that tension off first, and then progressing you to different stages where, okay, we can kind of put that nerve back in tension again and not get the same nerve response as you did previously.
I think that's really interesting. For a while at the clinic, we had a very fancy decompression table, and I was really disappointed in its results. And I think that this method really explains probably why it wasn't always successful, because it's a one direction decompression unit. And for some people, it was awesome. It really relieved the pressure. But for some people, it created other issues or other weird pains or referrals into their legs. And it definitely wasn't an answer for everyone. We no longer have the table, but I think this is interesting because there is so many different areas where we need to specifically target that decompression or that relief position, that opening around the nerve.
Yeah, I mean, without getting too bogged down in the medical details, neurodynamics is really just about being specific and really figuring out, okay, is it tension or stretching, or is it compression, like something actually being stuck, like how your body can move around that to either cause more pain or cause relief. And that's the thing about nerves, is that they're very finicky, and symptoms can pop up, in any which way possible. And
it's not something we think about a lot either. I mean, we think about muscles, we think about joints. We've had an episode where we were talking about fascia. We don't ever really think about fascia. It's not like a common way what we're thinking about things. But then also nerve pain, unless you are plagued with it, you're not thinking about it unless you have a specific nerve pain condition oftentimes. But I love what you're saying. It's really just a way, it's a methodology, it's a sleuthing, it's that Sherlock Holmes of thing. It's getting in there and peeling things back house style to understand like what is the problem that's happening here. And then we can figure out what's the best way to correct it.
Absolutely. And it's not the end all be all answer.
Yeah, it's one part of the process. Yeah.
There are a lot of working parts, like we said earlier.
When you think about some of the most commonly treated or most successfully treated, or maybe this is maybe your starting point for assessing what's happening when it comes to different conditions or issues, what's a few of the most common things that you would say this is a really great place to start with?
As in terms of like injury or type of condition?
Yeah, injuries or conditions.
I use it a lot on people with low back pain and leg pain. Low back pain, leg pain, and or neck pain with arm pain. Those are kind of like the most common conditions that this can treat, and very successfully, as long as that's where the pain is coming from.
Sorry, interrupted you.
No, it's okay.
No, just I loved it when you were talking about specificity, because I think that's something that's so missing in especially in manual therapy. There's so much generalization of people go to the orthopedic and they're told they have a rotator cuff problem. Where my favorite is always the trochanteric bursitis of the hip, right? And there's all these other multitude of things going on, and I think here at Head to Toe we're so good at being specific, both now with the nerve pain and where that's coming from, plus with what is the soft tissue injury? Is it lymphatic? Is it fascial? Is it a tendon? Where's it coming from? What do we need to do? How do we need to repair that? And really knowing and understanding what's going on, rather than just giving that sort of broad stroke, tendinitis type of diagnosis, which is just so vague and so often so poorly managed, I find.
It's a poor diagnosis.
Exactly.
It's usually a poor diagnosis.
It's a poor diagnosis. It's usually completely inaccurate.
Well, you throw spaghetti at the wall and it sticks.
Right. Exactly.
But yeah, I mean, especially with those, like, when we talk about like all those conditions, like whether the nerve's compressed or whether it's stretched or there's a lymphatic issue, there's a really tight muscle. It's probably all going on for each injury, right? It's to some degree. You just have to, like Dr. Ashley said, be really specific for this certain area, where you're going to have to decompress the nerve in one area, but you're probably going to have to make it so it doesn't stretch in the other. Things that we call like a double crush injury. That's a very common thing that we see in this office. And that means that there's just a tension on the nerve in multiple different areas rather than just one point.
That's a really good point.
Yeah, and you always have to consider that. And it's so common. I mean, I see it all day long. Yeah. And I know that you all do too. And if you were just thinking of just treating that compression in one area, like my favorite is carpal tunnel, right? I mean, do we really? I mean, the carpal tunnel is just one of so many structures that could be compressing that nerve pathway. And if we don't think about all of that, you could be getting surgery that you don't need.
Yeah.
True.
It's usually in the forearm for carpal tunnel
So
or the
often.
shoulder.
So often. Right.
And I think patients find a lot of value in having their healthcare provider kind of dive into that and into different spots and really trying to figure out, okay, where and what, my symptoms are coming from, instead of giving you the tendonitis or like the osisitis type of diagnoses.
Big trend in healthcare just these days is this whole notion of personalized medicine, really understanding and dialing in to your particular body, your particular structure, and the whole kind of biodynamic system that is uniquely you. Like, what do you specifically need? And that takes time, and then it takes a methodology that allows for precision, precise, personalized. That is the future. That's what's happening now. And that's really the trend. And that's away from how things have been for a long time, which is in and out really quick. Here's the general thing. Here's your general pain meds, or here's your general PT program. And that still happens, unfortunately, for a lot of people. But if that is the situation you're in, I think it's a really great time to realize, wait a minute, there's a whole other approach that gets way more specific and personalized. And that is the future, man. That does not have to be like an elite athlete to get that level of personalized, precise medical insight into what's going on with your body.
That's what we do here.
That's exactly what we do here. I have a friend. I have a friend who has had a lot of back issues, and he went to see a kind of a spine doctor specialist, and it's like you have a disc issue, and it's like, it's going to be a year before you can get back to normal activity, and you need to go see this PT and do more PT work, the same PT work she'd been doing before, and I was like, well, I don't want to tell you what to do, but
sometimes you just need a different approach.
Should go to head to toe.
Yeah.
I know I'm a broken record. Well, Ashley, we are super pumped to have you bring your expertise in this area and bring a whole kind of new element in a way for us to continue to evolve how we're treating these different types of issues for people, and how to get very specific in the treatment methodology. So super excited to explore this. I'm excited for you to kind of work some of this neurodynamic magic on me. I haven't experienced it yet, so I have to book a treatment session.
Get in line, Barry.
Yeah, exactly.
Oh, yeah.
Awesome. Well, Dr. Ashley, thank you for being here. Dr. Lee, Dr. Annie, as always, it's a pleasure.
Pleasure.
Until the next show, be well, move well, and we'll talk with you later. Thanks, everybody.